Okay, we will get started. Hello everybody and welcome to today's webinar. Today we are going through supporting your employees and yourself with LifeWorks Employee Assistance Program for CLCs. My name is Sam Cooper and I'm the Sector Sustainability Coordinator at Community Legal Centres Queensland. Before we get started, I'd like to acknowledge the traditional owners of the land which we are holding this webinar today. In Brisbane, they're the Turrbal and the Yuggera people. I wish to pay my respects to their elders, past, present and emerging, and acknowledge the important role Aboriginal and Torres Strait Islanders continue to play in our society. As this webinar is being viewed by people across Queensland and Australia, I'd also like to pay my respects to the traditional owners of the land throughout the country and extend a warm welcome to any First Nations Australians listening today. Today we're joined by Jacinta Solomon, and she's at LifeWorks, who will be talking to us about the challenges both inside and outside the workplace and how they can impact employees' mental health and well-being, resulting in disengagement, lack of community, loneliness and poor health. This webinar with Jacinta Solomon will provide an overview of the LifeWorks EAP and wellbeing support service for Queensland CLC employees, including LifeWorks services for employees and your immediate family members, EAP counselling, Manager Hotline, community legal counselling and financial counselling, LifeWorks wellbeing platform, and also a Q&A. I'll let Jacinta tell you a little bit more about herself when I hand over in a moment. Today's webinar is being recorded and we'll have the recording available to download later today or tomorrow. The PowerPoints and other materials have been emailed out to everyone who registered and are available to download from our website and also from the handout section of GoToWebinar on the control panel. There are two ways that you can ask questions. You can press the button that looks like a hand and we'll see the hand go up, and you can unmute yourself so you can ask your question via the microphone, or the easiest method is that you can type your question into the chat box and we will read the question out probably at the end. We will hold them over just so that we can make sure we get through everything. Please feel free to type them in as you think of them though. I'll now hand over to Jacinta in a moment, but I would just like to mention this webinar is the first session in CLC's new mental health and wellbeing CPD program, developed to assist frontline CLC workers to manage the impacts of COVID-19 and supported by a grant from the Queensland Community Foundation. This grant will allow us to source expert speakers on a range of topics such as vicarious trauma, emotional intelligence, developing self-care plans, and much more. Keep an eye out for future webinars and face-to-face sessions as well in this series over the next few months and also into 2022. Jacinta, take it away and I'll talk to you again at the end of the session.
Thank you, and thank you everyone for attending today. My name's Jacinta Solomon. I'm your account manager. I've been supporting your team for years now, and it's always been a pleasure. So really appreciate the invite to be able to speak to you all about this wonderful wellbeing program that's here to support you as employees and leaders, and also for your immediate family members. So if there's any leaders on the call, please take note of some of the things I speak about today, because you definitely can have access to this presentation and you can keep the message going, promoting to employees, or if there's a new joiner that starts, you can use these slides as well. So I'm going to go through the presentation and then I'm going to stop at the end of the slides, ask if there's any questions about the EAP component. Then if there's not questions, then we'll move into the other component, which I'm going to show you a bit of a demo of the platform. So I've been working with LifeWorks for about seven years now, but I've been in the wellbeing industry probably for about 20 years. So really excited to be here to support your team always, especially through these crazy times of COVID. Just, everyone's lives is always so busy, and just to add that extra bit of stress. So I think this program's going to be really good to help support you, and also remembering that we can support immediate family members as well. So one of the components of the program is the EAP. Now, I'm sure most of you have probably heard of it. Some of you might have even utilized the service. It is a counselling service, which is one of the components, but the way that I like to promote it is having access to your own personal life coach, because I still think that people feel that counselling is reactive when EAP is not. It's about being proactive around your well-being and your mental health, just the same as what you worry about, what food you eat, trying to eat healthy, trying to do all this exercise, the importance of mental health as well. And we know with the way the world's going at the moment and in the media, we start to realize it's okay when you're not, if you're not okay, and it is okay to speak up to your team. And EAP is not about just major issues. It's about any issue. No issue is too big or too small, which I'm going to go into more details on the type of issues that you might seek support for. Another big component is confidentiality as well. I know this is quite a personal service and you are going to speak about your key issues that's going on, whether it's personal or work related, but confidentiality is huge for us. So it's something that I really am abided by as account manager to support you in a private and confidential manner.
Sorry,
so something I really wanted to remind
you. Interrupt. I'm not sure that they're actually able to hear us.
Oh.
I am just getting a message saying that they're getting this webinar presentation will start shortly message. So I don't know if they're getting. Give me 2 seconds. I'll just make sure that.
Sure.
Might be something going on with the program. It's a good practice, right?
Yes, I'm just glad it's not on my end.
No,
I'm glad I can at least hear you. I'd be freaking out if I couldn't hear anyone.
No, it just says that the session's already running. We might, I'm not entirely sure. We do have to continue. We are recording it at the moment. So potentially we can just hand it over as a recording.
Yes, sure.
So if you potentially would like to continue, and then I can of course let you know if we need to turn back into another solution.
Yeah, sure. No stress. So you want me to continue? Yeah. You just let me know.
Yeah, please. That would be wonderful. Thank you.
Okay, sure. No worries. So some of the key features of the EAP, it is voluntary and it is free. It is there to support you. It is generally short-term cancelling. So you're actually offered 4 sessions per renewal period. So each year your sessions reset. Saying that, we do offer per issue as well. So for example, say if you have relationship issues and then 6 months down the track, you are going through some grief, you can actually start up a new client card. Now we have both virtual support and face-to-face. So with virtual support, we have video and we also have phone. Now, I will mention with COVID, we are noticing some really lengthy times with face-to-face. Now, this is not just an issue for us as a provider, but this is actually a bit of an issue across the world, actually. But the good thing about being with LifeWorks is that we have our own dedicated team of virtual support counsellors that only support our clients. So it means that you'll be able to get a session in a timely manner. So usually you can get at least a virtual session within 1 to 3 days, sometimes even on the day when you call. Saying that, if you're ever concerned for your well-being, please let us know, because we would escalate for someone to speak to you that day. Any level of risk, we would never ever let you wait for a session. We also support family members. So when I say immediate family members, it's family members living under the same roof as you, whether it's a spouse, a partner, children. Now, generally we are support to adults. So, if you do have a child that's going through quite some serious issues, I probably would go back to your GP and get external support, only because children are so sensitive and it's really important that they get the right clinically appropriate support. Saying that, we do have some counsellors that can support children's 8 and above. Now, this can always change, so the best thing to do, if you're ever thinking about bringing along a child, just give us a call through the call centre and just let us know, and we'll let you know what's available. And if we can't support that age gap, at least we'll encourage you about going back to your GP and getting that external support. So what are the reasons why you might access the EAP? So these are just some of the key issues. It can be a mix between personal and work related. Even though this is a workplace program, most people actually seek support for personal. For work related ones, it could be stresses with work. So, you know, your everyday role, relationships within the workplace, conflict. Now, we're not here to replace HR management. You know, if you're ever having any issues with anyone internally or anything internally, we will always encourage you to speak to your manager or to speak to HR. But if you're not ready to speak to the team, at least you can speak to us in a private and confidential manner, and getting that support, and we can give you guidance and encouragement on how to handle the situation. Communication within the workplace. Any workplace change. I don't know any organisation that doesn't go through change. We've gone through lots of change here. I know that you probably, if you've been with us with Legal Aid for a while, you would know that we used to be called Optum and now we're called LifeWorks. You know, we have gone through lots of change here. I know some people don't cope well and some people do, and that's where the EAP is there to support you. Starting a new job, you know, it can be challenging. Return to work. So return to work could be from maternity leave or an injury or an illness, or maybe you took some mental health time off. Then you got life. So, you know, living with a disability, making sure you're keeping work-life balance. Retirement, you know, even though it's an exciting time, it can come with some stresses, or going through some grief. Then you got money. So through the EAP, I don't know if some of you realise, but we do have some counsellors that have legal or finance background. Now, just be mindful, this is an advisory service, so you're not going to be speaking to an actual lawyer. It is a counsellor with legal background or finance background. Now, if you're ever looking at accessing a counsellor with legal or finance background, you do need to let the call centre know. So our counsellors, pretty much all our counsellors can support all these key issues, except for not all have legal or finance background. So if you're looking at requesting that type of service, please let the call centre know, because they need to allocate the right counsellor for you. And with legal and finance assist, it is only over the phone. So you can't speak face-to-face, but you can speak with someone over the phone. Also, we are quite limited to the amount of counsellors with finance and legal background. So I know people like to put off this call to the last minute. So if you're ever thinking about using that service, give us a call and we will escalate for someone to speak to you ASAP. Then we have family related. So becoming a parent, going through all these different stages, elder care. So, you know, looking after your family, relationship issues. Now, all our counsellors can support relationship issues. We do have counsellors that also can support couples. So if you're ever seeking couple counselling, just need to let us know, because we need to allocate the right counsellor to support you. Then you got health, addictions, diseases, health conditions, mental health, just living a healthy lifestyle. Now, addiction's an interesting one, because sometimes EAP might not be the right space for your issue. And that could be because it's just not clinically appropriate. So, for example, you know, eating disorders. You know, we can support emotionally, but maybe a drug and alcohol. Maybe that's probably more medical, or drug and alcohol. Maybe a drug and alcohol centre might be better. So EAP is always a good place to start, but there might be times where the counsellor feels that EAP is not the right space, and we'll discuss with you about going back to your GP and getting that external support. So it's not that we don't care, it's just that it is good if the clinician realises from the start that this is not the right space for your issue, referring you on to get that support externally from the EAP. Now, you also have access to our wellbeing platform. So I'm sure a lot of you are quite used to, I know I am quite used to checking in, especially here, because I am based in Melbourne. So I'm quite familiar with the QR code, but if any of you have your phone at hand or take a photo, there is the login details to a wellbeing platform. Now, rather than myself talk about this slide, I am actually going to do a bit of a demo at the end of this session. So it is easy login for you, because your username and password is both Community1. So it's easy to log in. And once you've logged in, you can either access as the PC version, or you can access the app. So the app's going to be a little bit more condensed, but still has a lot of the support and resources. And then also you have the more expanded version, which is through the web. Now, if there's any leaders on our call, I did want to mention about the Manager Hotline because this is a great component of the program. I know that managers, leaders, HR are fantastic at problem solving because, you know, that is why you're in your roles. But imagine having access to a senior clinician about an issue that's going on internally and you can get that support. Now, this doesn't affect your 4-session allocation. This can be used unlimitedly. Now, it is a manager hotline and it does require you to make a booking. So I know that even though it's a hotline, you think that you're just going to speak to someone straight away. It can take about 1 to 3 days to get one of these sessions because it is with one of our senior clinicians. Saying that, if you're ever calling because you're concerned for employees' wellbeing, please let us know because like the EAP, any level of risk, we would escalate for someone to speak to you that day. It's really important to remember. So if there's any level of risk while you're accessing the manager hotline, please let us know and we'll escalate that for you. So why you might access the manager hotline, you know, maybe you're concerned about employees' well-being and you want to get some advice, or, you know, with this environment for, you know, during COVID, you know, how to support your team, or, you know, maybe there's been some conflict between 2 employees, or maybe an employee's, you know, having some anger management issues, you know, something that's going on in the organization and you want to get a psychological view on the situation, this support is here for you. And like the EAP being private and confidential, this is private and confidential as well. So your organization doesn't know that you have access to the manager hotline. We also give you access to a broad range of counsellors. We are actually across the world, but we do have a lot of counselling services all across Queensland to support you, even in regional areas. And when we can't offer that, we do have our virtual support counsellors. And the good thing is about LifeWorks, we don't just allocate any counsellor to take virtual support. We actually have a dedicated team who are in our office that are on a set model, trained by our senior clinicians, and only support our clients' employees. So you can always have a virtual support session in a timely manner. I am going to show you how you can access the number also via the platform. So I'm just going to talk about one last slide about key tips before I log out of this, and then I'm going to show you around. So some key EAP tips to remember is that you can always keep the same counsellor. Now, if you've spoken with a counsellor and you really connected well, fantastic. You can keep speaking to that counsellor and, you know, keep continuing on with your sessions. One tip I really want you to remember today is that you can always change your counsellor. Now, this is probably, you know, sometimes I get feedback about this from a manager or HR or employee said they've accessed the service, they didn't connect with their counsellor, and then they think that that's the service and they don't go back again. That could be because that counsellor was not the right fit for them. And that could be a numerous amount of reasons why they are not the right fit. It could be the expertise of the counsellor, it could be the learning style of the employee, it could be the personality traits, it could be you just prefer a female male or male or female. So really important about finding the right fit. And if you don't feel that counsellor was not the right fit for you, don't feel bad if you think that counsellor was lovely. Our counsellors know that they are not the right fit for everyone. So give us a call back and let the call center know, and they'll allocate someone new for you. And then hopefully you have a more positive experience when you have your next session. And I know this firsthand, you know, when I seek support through our EAP, you know, I've spoken with a counsellor and look, she was lovely. I probably didn't get as much from the session just because of my learning style. And then I spoke with someone else and then she was a lot better for me. And then I keep speaking to her. So I know the firsthand the importance of finding the right fit counsellor. Also remembering, don't wait till a crisis. You know, if you are feeling overwhelmed, you know, or if you've got anything worrying you, like I said, this isn't about being reactive. It's about any issue. No issue's too small. So give us a call, and because you've got the virtual support counselling, it means you can have a session so conveniently. You don't have to go out to an office. You can have a session before work, on your lunch break, after work. It Makes it so convenient. And also, don't wait until the end of the week to give us a call. Give us a call at the start of the week. So then you can get that session booked in that week. And then by the time the weekend comes around, you're feeling good, because you don't want stresses, overwhelming you when you're on the weekend. You want to really enjoy them. So that's what this service is all there to support you about. Just a reminder that generally we are support to adults, but currently we do have a few counsellors that can support ages 8 and above. Now, we are quite limited amount of counsellors with that can support children, but the best thing to do is don't hold off that call. Give us a call, let the call center know, and then they will discuss the process and get that booked in for you. Also, remembering to look out for each other. People haven't seen this session. If you're a leader, keep bringing up these slides, promoting it, keep reminding employees about this. Remembering family members can access the service. Remembering to use the full scope. So whether it's the EAP, which is the coaching service, where it could be face-to-face, phone or video. Then also it could be the key issues that I spoke about. You can do couple counselling, but remembering that you need to let the call centre know if you want to see couple counselling. We also have those counsellors with finance or legal background. Just need to let us know if you want to access that. Then you've got the Manager Hotline. And then I'm also going to show you the platform as well, and how it can support you as employees and also as leaders, if there's any leaders on the call. So I'm just going to stop sharing my screen. And does anyone have any questions? Can you see any questions in the box, or can anyone still hear this session before I go out and show the platform?
Not at the moment, but if you could show the platform, that would be wonderful.
Sure. Can you see the platform?
Yep, thank you.
Great. So as I mentioned in my slides earlier, I did put the login details for the platform, which is easy. It's just community one. This gives you access to support and resources around your wellbeing. So you might not be ready to give the EAP a call, but you're just looking for some support and resources. This platform can help you. So this is private and confidential as well, so your employer won't know that what you've been clicking on if you're seeking support through the platform. This is just to give you some support and resources, rather than, I know everyone likes to do it, but rather than going self-diagnosing yourself through Google, this is where you'll come. So the team are always great at updating articles, adding new functions, so always worth to keep checking it out. So, they'll always have featured articles, whatever's going on in the world at the moment. You can click here. Under the support and resource section, they do break it down into 5 different pillars. So family, health, life, money, and work. So you can go through and have a look at the different pillars. As you can see that there's different topics under there. Also, if you're looking for some articles around set topics. So for example, probably the top 3 topics through this time is stress, building resilience, and mindfulness. It is a bit of a crazy times, and it's really, we are quite all resilient, and also practicing mindfulness has been really important, especially if, your workload's really busy or you're always worrying about things, trying to think more in a positive frame. So this platform might help you. So whatever you're looking for, whether it's stress articles, building resilience, mindfulness, or whatever you're looking for, you can go through the different pillars, or if you just type in the word that you're looking for. So for example, I want the articles around stress from all those 5 different pillars. I type that in. It would do a search, and then a whole lot of articles, also audios and videos. So it's not just articles, it gives you access to audios and videos that you can have access to. So you can go through, have a look at see if there's any sort of topics that suit you. I will also mention that, just for example, I am just going to click on, just to show you, if any leaders are on the call, or if there was an employee that wants to share an article with a family member, you can always encourage them to access the platform. Or the great thing is, the bottom of every article you can actually save as a PDF, you can print, and you can share. So, you know, if you want to share it with someone, you can access that and save it and print it and share with them. So going back to support and resources, this is another great way to always have the phone number there at hand as well. So I'm not one to carry around wallet cards these days. You know, I always have an app. So I've downloaded our app internally, and I think it's great, and I utilize it too. And if I ever want to access my EAP, if I click on here, this will dial into the call center and you can make a coaching service. So it means that you'll always have the number there at hand if you ever need it. So I know sometimes people say, I don't need the EAP or this wellbeing platform app yet. It is good to just have it there because you just never know what's going on in your life. You can have that support there. So if I clicked in there, it will take me into the call center and I can make an appointment. Also, there's like a live chat section. Now, just be mindful, it isn't live chat with a counsellor. It is live chat with someone in the call center. So a call center representative, if you're not ready to give us a call and you just want to ask some questions about the EAP, you can actually speak with someone directly there. So you can click there. Also, under the support and resource section, so you can go to the different pillars. I will also point out one section because you might not notice, but under the work section here, there is a manager's toolkit. So as I mentioned earlier, we have the Manager Hotline where you can call up and you can make a booking over the phone and speak with the senior clinician, or maybe you just want some resources to support you as a leader. This is where you go. So if you click there, there is a manager's toolkit that's there to support you. As I also mentioned, there's videos, there's also audios there. There is also a COVID support toolkit as well. So the team created this last year because, I was getting a lot of emails from HR, do you have any articles to support our employees, whether it's personal or work related, because everyone's situation's been different through this. So this is a really great resource to support your team, whether it's personal or work related. There are so many different articles within here, and the team are always updating it. So it's worth checking that section out as well. Another component of the platform is the lift session. Now, some of the feedback that we heard from employees last year that, especially when we go on lockdowns and you can't access the gym, or people just looking for a new routine, is now you can have access to a fitness app. So last year we added this, and look, I am based in Melbourne, so I do know what it feels like for harsh lockdowns. And I stopped going to the gym last year, and I was walking a lot when we were on lockdowns, and then I decided to take up this offer when we launched the Lift Session app. So we were always going to partner with a fitness app, but we escalated it to happen a little bit more sooner. So what I did, I clicked here, I signed up for free through us because LifeWorks has partnered with Lift, and you're a partner of ours, so you can access for free. So I signed up for free. Then you go to the app store and you download the Lift Session app, and rather than signing up, which would usually cost money, you log in. This will give you access to a fitness app. So you type in what your fitness goals is, and it creates a program for you. Now, I actually used to be a personal trainer about 10 years ago, and I've done some of those crazy apps out there. And look, there is probably ones that are out there that are harder, but it's really about going back to basics and doing exercises that you're going to just keep continuing to do. These are great because they're about 30, 40 minutes max a session. You follow a little personal trainer. You also put in your level. So it's beginners, immediate, or advanced. I just started on beginners, then I tried immediate, now I'm on advanced. I don't even find advanced too crazy. I actually wear my Fitbit when I'm doing these sessions, and I click on my Fitbit to record, and they do get your heart rate up. So you're doing things like star jumps, push-ups, lunges, all that sort of thing. And it does get your heart rate, which is really, really good. And I try to do one of these each morning before I start work. Now, everyone's different. Look, you might be more of an afternoon person, but you don't need any equipment. You don't need much room at all. So I have been continuing to doing these. I haven't been back to the gym yet. So I've just been, trying to eat a healthier, balanced lifestyle, still enjoying my food. And doing these lift sessions and walking. So it's been a really good, consistent program for me. And look, I'll probably go back to the gym at some point, but you can do these even in the gym as well. So you don't need much room. So you could probably do these in the stretching area. That's when I used to do these sort of sessions. So this is really, really good to check out. And remembering you can invite a family member to access that as well. If anyone's having any issues with the platform, there is a web. So you just click on here and there's also like Q&A questions. You can speak with someone directly. So you can get that extra support through the web help section. So that's probably like the main gist of the platform. There is so much on here and it's always worth to keep checking it out because the team are always updating. You can even change the language under the settings section if someone ever wants to. There is more articles in English, but there is that option to change that. But this is such a fantastic tool. So, you know, before you're even ready to give us a call through the EAP, you might come in and check the wellbeing platform because it's there to support you as a team. Now, I'm going to stop showing and just see if anyone has any questions or if anyone can still hear the session. Just going to stop sharing my screen.
I do have some questions, and it might need you to continue to share your screen on the platform. But as a manager, how do we use the platform or use the EAP to look out for signs of struggle for when an employee may or may not be coping very well?
Yeah, so that's a very good question. So the EAP is there to support you as a leader. So if you're noticing an employee that's not coping very well, that's where the Manager Hotline is there to support you. So you can speak with them, get some advice on what's going on, and then you can offer them the general service. So they have access to this number. They also have access to the platform. So you can give them that support. Also through LifeWorks, we do a lot of, so I'm more of an account manager, so I'm really good at, you know, giving you the resources. If you want to get that real full support from like a counsellor, we do run sort of sessions like training for managers about supporting employees within the workplace. We do things like outside the general OP, which is like workshops. You can just speak with someone through the Manager Hotline. So if you ever want to discuss about, you know, exactly getting that training as a leader on supporting your team, please let me know because I can let you know sort of other services besides by the Manager Hotline, how it can support you as a member, as a leader as well.
Thank you. And in terms of an EAP generally, do you think that sometimes EAPs get a bad or controversial kind of reputation, such as people having to speak to different counsellors all the time, and how do you kind of continue to work around those sorts of issues?
So EAP, I don't feel like it gets a really bad rap, but it's just with EAP, yeah, sometimes a counsellor might not be the right fit for you, and that's why I always mention that in this slide, in this session, because it is really important about finding the right fit. And the good thing about having EAP in place means that you can get a session a lot quicker, because I know it is lengthy wait times if you're going back to your GP and getting that external support. The good thing about being with an EAP provider is that we have our own counsellors. So it means that, you know, when your employees are accessing a service, they can get a session in a timely manner. But like I mentioned, it is important about finding the right fit, because, you know, when you speak with a counsellor, and as we all know, we don't all connect with everyone, and that is the same with the counselling, like you know, any counsellor, and that's just even the same outside the general EAP. You know, you could be connected from a GP to your counsellor and you might not have the right fit. But the good thing is with the EAP program as an employee, this is a staff benefit and it's complimentary to support you. Also, it is confidential service as well. So yes, sometimes there might be times where an employee spoke with a counsellor and was not the right fit for them. But that's why these sort of educate sessions is good to sort of discuss and put it out there that it is okay to let us know if they don't connect with the counsellor, and we can allocate someone else. Because usually when you've spoken to a new counsellor, you know, usually you have a more positive experience with the service. So that's why, yeah, these sessions are really, really important, just to sort of let your team know, and especially if there are any leaders on the call, to keep that message going and using my slides and reminding them about all the key points about the EAP and how it can support them as leaders and how it can support their immediate family members and employees.
Perfect, thank you. And is there any limit on the number of sessions that people can have?
Yeah, so it is 4 sessions per renewal period. So each year your sessions reset. Saying that, it is per issue, but usually most employees would probably access it once or twice, and then they might be okay for a while, and then they might come back and visit the following year. Or if it's quite an in-depth issue, they might use all their 4 sessions, and then say, for example, say if you utilized it for, you know, relationship issues, and then 6 months down the track you used all those 4 sessions for that, and then now you have conflict in the workplace, you do have that option to set up a new client card.
And have you seen a rise in the number of people accessing the service during the pandemic?
Mm-hmm. So, very good question. When it first hit last year, I was worried that, you know, how's this going to, you know, can we keep up? Do you know what? When it first hit last year, our calls dropped by about 50%. And this was for all EAP providers, cancelling services, because everyone was really worried about looking after themselves. If they had to work from home, they're in lockdown, no one was actually looking after their own general well-being. Over time now, it has changed, and now we're noticing people are starting to become, you know, they know this is the norm, and they are starting to look after their own well-being. So we are noticing, you know, more of an increase with EAP. And yes, we have noticed wait times for face-to-face has been increasing. But like I said, the good thing about being with LifeWorks is that, yes, we do have our own virtual support counsellors, which only support our clients, which means every time I asked if there's been any sort of wait times, you know, long wait times, we haven't had that within our virtual support. So really, really vital through this time to have that behind me. Me as an account manager, my workload's probably very, very, very high, but as you can imagine, because I am supporting managers and leaders, and they're the ones that want to make sure that their employees are supported. So for me as an account manager, my workload has increased, but as a cancelling perspective, we haven't had any issues with wait times when it comes to at least virtual support. Our clients have always been supported being with LifeWorks, which is really good, because I know some EAP providers would be struggling right now if they were just relying solely on providers, because we are noticing some providers are so busy, and they, you know, if they take on more of their private sessions, they're going to get more money. So it is a bit competing out there at the moment. So that's why LifeWorks, yeah, it is good to be with us at the moment, just because we do have our own counsellors, and we're always increasing that network as well. So we're always revising, looking at areas that need to grow, like locations, whether it's face-to-face or if we need more virtual support counsellors. We have a dedicated team that are always reviewing this, and that's why I have not had one complaint about wait times through whole time of COVID.
Thank you. And you mentioned that people get 4 sessions. Can those sessions be with the same counsellor?
Correct. Yep, definitely.
Perfect. And in terms of making sure that the services are accessible and appropriate for everybody, do you have specific training protocols? For example, do people need to have undertaken cultural awareness training to further support Aboriginal and Torres Strait Islander staff?
Yeah, we all have. Not just counsellors, us all. It's really important for us as a business. We have ongoing modules. Counsellors have proper training. It's something that we really do support. So definitely 100%. Yeah, that's, you know, we're always being sent different modules each, you know, sort of period, making sure that we're always educated, or if we need any further training, we're always re-looking at that as well.
Thank you. And is there any way that you might be able to, on the platform that you've got sharing now, be able to show us where we might be able to find some of the signs that staff are not coping very well. Is there any articles on there, or can you show us how we might want to search for something?
Yeah, so if you ever want to search for something, you just go support and resources and you just type in what you're looking for. So you could type in the word mental health, or if you type in the word stress. So if you go into there and you press that, enter whatever you're looking for with the platform, it will show you or bring you up a whole range of articles, which you can, if you find something that's suitable for your employee, if they are going through a tough time, you can encourage them to access the platform, of course. But if we know not everyone's going to be on the platform and app, so if all leaders are on it at least, then if you find an article that's valuable, you can actually save as a PDF and you can share it with team members if they're not coping well. So it's really good to keep checking the platform out, because they're always updating and adding more articles there to support our clients.
That's a great idea, sending around some of those articles, even when people are not struggling, just as a reminder to continue to watch out for their mental health. Are there other things that managers can be doing to make sure that their staff are feeling supported during these high times of stress?
Yeah, so I guess that's probably more in the further support services. We have been running lots of programs outside the general EAP. So, I can equip you with the resources and tools, but we have been running sessions like leading through COVID, managing mental health sessions for managers. So equipping them with tools on how to support their employees. You can always, like I mentioned, you can always call up and use the Manager Hotline, or you can get your resources through here. But we do, and a lot of organisations have been organising further support programs outside the general EAP. So in this sort of forum, so whether it's a workshop, whether it's awareness type session, but managers have been dialing in as we've been running these sessions, and it would be like a counsellor, so a facilitator that be presenting these sessions. These type of programs do come at additional costs though, but if you ever wishing a quote about any sort of additional support for managers outside the EAP, just let me know and I can request that for you.
Wonderful. And I think something that comes up in our sector a fair bit, all of our organisations are all independent, and so sometimes the role of the manager, or sometimes it's a dual role where it's the principal solicitor and the CEO or the director. Are there resources in there that can help us to be able to really effectively manage our own mental health? Obviously, managing our staff and helping our staff through these times is really important, but where in this platform is there something that we can help ourselves or make sure that we're looking after ourselves as well?
As leaders?
Yes, as leaders, yeah.
Yeah, so that's under the, as I showed before, the support and resource section. There is a manager's toolkit. So that's a really good section. I would go, if any leaders are on this call, go into this section, because this is where you've got support and resources to support you as leaders, and the team are always updating this. So you've got the manager support line, which you could speak with someone over the phone. I've even got like a manager's resource guide if you ever wish that as well. You can also have access to this presentation, and also you can get resources through here. So really good to check this out, because it is a proper toolkit for managers and leaders, and it is really important to look after yourself as leaders. Like, this is not just a service for employees, it is here to support you as leaders as well.
Thank you. And I think the next question kind of speaks to, I know that you've spoken a lot about what's in the toolkit, just wondering whether you might have some insights though about providing support both in and beyond the workplace for our employees, both obviously at the time that you start to recognise there might be some signs of stress, but also beforehand, and how we might be able to do that.
How to recognise on signs? Yeah,
how to provide support both in and beyond the workplace if someone's struggling or beforehand.
So that's probably would be a really good, because I'm not a counsellor, those sort of training sessions we do run. So, you can always access the EAP, where you got the, like I've mentioned, the support and resources, the manager hotline, and that is there to support you if you need some guidance. I would suggest, if you're actually looking for proper tips, then maybe we can discuss this off the line, but I can send you some options of training for managers to help them in their roles. Because, you know, I'm not a counsellor to sort of give that sort of knowledge and tips. Maybe like a session we can maybe look at in the future where we can set up with an actual counsellor, so then they can, you know, have your managers dial in and have that sort of conversations with maybe a senior clinician or something like that.
Wonderful. Yeah, that would be amazing.
Yeah.
And in terms of connecting with external supports, if our staff are accessing EAP and they are then at their limit for 4 sessions and need to access further support, is there any way that your counsellors can link in with their external supports?
Correct. So do you mean if they need additional sessions beyond the 4, like they're requesting another 2?
Yeah, if they need additional sessions, but equally if they then choose to go and get support from a GP, for example, and get external counselling.
So it's called the referral process. So your employees can either request, say if they finish their 4 sessions and look, they don't need long-term support, and the counsellor employee just feels maybe 2 more sessions might close the case. Now with Queensland government clients, usually you will prove up to 2 extra sessions. Any further beyond, it starts becoming long-term support. And if with the referral process, what that looks like is when the employee comes towards the end of the 4 sessions and look, additional sessions might not be requested, it's more going to be long-term support. This is where the counsellor will be encourage your employee to go back to their GP and getting that external support. And good thing about living with us in Australia, we do have a good mental health system behind us. So it used to be like 10 sessions through their GP. Now there is like 20 sessions that they can access now. So that's where the counsellor will be discussing that. But if it's just coming towards the end of the 4 sessions and the counsellor just feels, look, you don't need long-term support, they can request these through the EAP. So this would come through to me, and then I would just email the legal aid community. Or sometimes a manager might, employee might feel comfortable speaking with their manager, saying, look, I really connect with my counsellor very well, like a lot, and I'm coming towards the end of my 4 sessions. Do you think you can approve another 2? Yes, you can do that that way as well. So you would email myself, and then I take it through the process of sending it to the team. They do need a review if it's clinically appropriate. And they'll look and say, no, we can see that this issue is not going to be long-term. Usually they'll approve up to 2 max, because it is generally short-term cancelling. But the managers definitely can reach out to me, which happens a lot, and then I take through the process, and this can take up to 3 to 5 working days to go through our processes, because it gets reviewed by clinical. We also speak with the provider or our counsellor, whoever's taking the sessions, and also time for us to make sure that it's updated to the client file with the extra 2 sessions if approved.
Perfect. And in terms of maintaining confidentiality, I think generally across the sector, there is an appreciation for EAP services and for the support they can provide. There can sometimes, though, be a bit of a hesitancy about, how confidential is it really, or, does my employer or my supervisor need to know that I've accessed EAP? And we've heard mixed kind of messages from different providers. Is it likely that in LifeWorks the name of the person accessing EAP is going to be given to the organisation, or is that kept confidential along with everything else?
Good question. Confidentiality is huge for us, and we never give any names back to the organisation. I won't even give you information. Say if you wrote to me and said, Kate Smith has finished her 4 sessions. Can you just check with her? We check on her file how many sessions she's got left. See, I wouldn't even give that information as well, because I don't know if you're trying to look in if an employee is accessing the service or not. Confidentiality is huge for us. So even if I get additional sessions, I would write to legal aid saying, there has been 2 additional sessions for employee. I don't even say if it's female or male. I'm always saying a employee. So confidentiality is huge for us and huge for me. To give you a bit of an understanding on how important it is to me, I have had HR in the past. Once, this has only ever happened once, where I tried to request additional sessions and that employer felt it was duty of care. I let them know who that employee was. We had a sort of bit of a misunderstanding. She thought it's her duty of care. She's like said, look, I won't tell anyone. I said, unfortunately, I can't give you that information. You can either approve additional sessions or you don't. And that client did get a bit disappointed and annoyed because she wanted to know the name of the employee. So we had to come to terms and we had to let that client go because she's like, no, I want a service where I can request names because it is duty of care with me. She did realize it was not the right thing. She did write me a nice email after I left, like after we sort of left our sort of, relationship partnership. But just saying that's how important. But I've only ever had that ever happen once from a HR HR representative. All organisations know generally this service is a private and confidential, and everyone else has been pretty good with this. I know your team is all about confidentiality, but just to give you a bit of background on how important it is to me, and I would never ever give any names up, even if it has to be a risk of losing a client. It's really, really important for me.
Wonderful, thank you. And in terms of accessing those additional services, can the employee themselves email you, and do you have details somewhere on the portal, or do they need to go through their manager?
So do you say if an employee wants to request additional sessions?
Yeah, so if they've already had their 4 and they think, look, I just need a bit more support, is there anywhere that they can easily access on the portal your contact details, or how do they go about that?
They would just call up through the call center and the call center would let me know. But generally, this usually comes from the counsellor because it does need to be clinically appropriate. So if an employee did want to approve it, did want to review it, they can call up through the call center and they will email myself. But generally, this should probably be a conversation with the employee and the counsellor would actually take the employee through that process and do all that requesting for them, which would go to senior clinician. Then they would let me know, and then I would email legal aid saying an employee is requesting a session without saying their name and getting approval, going back to the team and getting that updated. So generally, it usually does come from the counsellor or from a manager, but I have had times where an employee can call up through the local number and it comes through to me, and then I start the process for them, still keeping it in a private and confidential manner.
Wonderful, thank you. And in terms of who can access it, one of the questions is, do people who are on casual or part-time rather than full-time, can everybody access the EAP? And I suppose that might come down to an organisation's internal policies, but is there anything on the portal here that can kind of lead people to be able to really clearly see whether or not they're able to access it, or can they access it if they're working for the organisation regardless?
Yes. So that comes down to, we offer it to all, but every contract's going to be different. If you want, I can stop sharing my screen and go into your contract and have a quick look. Otherwise, I can email this to you after. So usually it's full-time, part-time, and then some organisations are different, whether they might have casuals, contractors, volunteers, is slightly a bit different. I can stop sharing and quickly check for you, or I can email that back to you.
Oh, that's okay. We can take that one on notice. That's absolutely fine.
Yeah, I'll send you an email. I'll go in and have a look at the contract and see what's on there. We can always change that. That's easy on our end. It's usually set up by your organisation what is available.
Wonderful, thank you. And the last one is just about accessibility and in terms of kind of managing expectations. If you have a scheduled session and you miss it, is the counsellor likely to try to call back, or how does that kind of work? Does that count as an appointment?
Yeah, so there is a 24-hour cancellation policy. So if an employee misses their session on the day and doesn't let us know, then they will lose the session. So what we do when we make a booking, we do let employees know about the cancellation policy to please call us back within 24 hours so we can just reschedule so it doesn't affect their session limit. And also, if an employee is going to cancel on the day, we do try and remind them again that they will lose their session if they cancel, they're cancelling within 24 hours. So we really try and encourage employees to let us know if they are looking to reschedule, because we will outside 24 hours easily, and that would come at no extra cost. But we know sometimes people get busy, things can happen in people's lives. But yes, unfortunately, if you do cancel on the actual day, it will go towards one of your sessions.
Thank you. And the final question is, have you, in terms of your experience working within this sector, seen an improvement in the general overall wellbeing of people who are able to access EAP?
Yes, definitely. I think when I first started working in mental health in 2014, it used to be more of a tick the box. Like, yes, there was organisations that definitely wasn't, but over time, EAPs just become forefront, and looking after people's well-being, clients wanting to do more proactive programs for their clients. I have been running more of these type of briefings than ever, especially now that everyone can use virtual support. I have noticed a massive shift within the mental health space, and we are getting lots of new business as well, just because a lot of organisations are starting to realise. So when I used to go out and tell people what my job was, like I work for an EAP provider, they didn't really understand what that was. Now most organisations know what it is, and it is a common service that it's actually quite rare for organisations not to have it. Even the smallest organisation, I've got some clients that have like 20 employees. The importance of mental health is so huge now, and employers, I've just noticed a very, very big shift, and it just keeps growing and growing. And also the media really helps as well. As you always see, they're always talking about that's not okay. I don't know if you ever watched The Project, they're always reminding people about the number, or so it is really, it has changed a lot over the years, and it's continuing to just become the norm about talking about your issues. We also notice a shift, we know a lot of males that never used to use the service as much. It's a big shift now. Both females and males are accessing the service. Yeah, definitely has been a lot of changes over time.
Wonderful. Thank you so much for that presentation and for taking us through the platform. That's really helpful. To everybody who will now be watching the recording, thank you for your patience. And we apologise that we weren't able to get it all sorted in the beginning, but we certainly appreciate your support. Thank you so much for taking time out of your obviously very busy day. And I will just send you an email if we've got any follow-up questions, if that's okay. And we will get back to everybody as soon as we can. Thank you so much. We appreciate it.
My pleasure. Thank you, and thank you for all who will listen to this session. And yeah, appreciate your time. And it's always been a delight to support your team. So I wish everyone all the best. And I might speak to you soon. So have a great day, and bye.
Thank you so much. Thank you. Bye.
Thanks. Bye.